Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. Managed care experts from around the country gathered in Las Vegas last week for the Fall Managed Care Forum, presented by the National Association of Managed Care Physicians. Keynote speaker, Dr. Jacques Sokolov, Chairman and CEO of SSB Solutions, said that government is leading the way into value-based care, particularly in Medicare, which will force others to follow. He discussed the challenges facing ACOs, which suffer when their patient population fluctuates during the year. Said Sokolov, if you don't know who you're managing, you're really going to have a hard time managing them. Sokolov also discussed the controversy surrounding Horizon Blue Cross Blue Shield of New Jersey, which has found resistance to its OMNIA plan. While some experts credited Horizon for making an effort to advance population health and cut costs, the plan faced criticism for excluding several hospitals that serve the poor. Horizon has also been criticized for a lack of transparency in creating the network. This week, St. Peter's Hospital of New Brunswick won the right to a court hearing where Horizon will have to reveal why it did not include the Catholic hospital in OMNIA. The hearing is set for December 17th. In a move towards value-based care, CMS this week finalized a rule to require bundled payments for hip and knee replacements in 67 markets. These surgeries are among the most common in Medicare and can cost between $16,500 and $33,000 depending on the location. Under the new model, hospitals will be accountable for the surgery and all related costs through 90 days after discharge. Hospitals that meet quality and cost targets can earn rewards, but some may have to return money. The new model starts April 1st in 2016. The opioid epidemic has drawn attention from the nation's top health officials and public policy makers. To help combat the problem, the Pharmacy Quality Alliance has recently established a set of measures to strike a balance between individual patient needs and trends that could be a sign of problems. Dr. Woody Eisenberg explains.
Our measures are intended to be applied across populations of patients. So what we're saying, for example, is that even though any given patient may have needs for high doses or for these drugs for long periods of time, or maybe even from multiple prescribers, that over a large population, we're anticipating that this is something that we could measure and try to determine what the factors are that are leading one health plan or one provider organization or one accountable care organization to be prescribing these medications for their patients at higher doses for longer periods of time by more prescribers and having them pick it up at more pharmacies than a comparable organization. And we think that that comparison may help us to get a handle on this problem.
The FDA issued a report this week that paves the way for regulation of laboratory-developed tests, which cost Medicare $9.7 billion in 2012 and are widely used to make clinical decisions. The tests, known as LDTs, are typically designed and used within a single laboratory and until now have been beyond FDA's reach. Tests that do not need FDA clearance only require oversight by CMS under the Clinical Laboratory Improvement Amendments. The new report offers 20 case studies that show potential harm to patients because of gaps in today's regulations. Can SGLT2s be used to treat type 1 diabetes? That's the question researchers are trying to answer. This new drug class, approved to treat type 2 diabetes in 2013, has already been shown to have benefits beyond lowering A1C. In the current issue of Evidence-Based Diabetes Management, experts say the unique mechanism of action may prove beneficial for patients with type 1 disease. For the full story, see ajmc.com. For everyone at the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.